Welcome to Protecting Kidney Health, a presentation by the Kidney Foundation of Western New York. I'm Kidney Foundation Director Jeremy Morlock. In this presentation, we'll share information about the prevalence of kidney disease and common kidney disease risk factors, including diabetes and high blood pressure. We'll include steps that you can take to protect the health of your own kidneys, information on medical testing, and information on treatment options. This presentation is intended for general audiences with an interest in kidney health. Our foundation also has more focused presentations for people with advanced kidney disease, people on dialysis, and those seeking a transplant. Kidney disease affects people of all ages, income levels, and cultural and ethnic groups. However, some people have a higher risk than others. 1 in 7 Americans has chronic kidney disease. Many of those people with chronic kidney disease don't know it, because the person can lose up to 90% of their kidney function before symptoms appear. Identifying kidney disease early is important because early identification and treatment may keep chronic kidney disease from getting worse and may prevent additional health problems. Diabetes is the leading cause of chronic kidney disease, followed by high blood pressure. About 1 in 3 adults with diabetes has kidney disease, and about 1 in 5 adults with high blood pressure may have kidney disease. The kidney is the most transplanted organ, and it's also the most needed organ for life-saving transplants. Right now, more than 93,000 Americans are waiting for a kidney transplant. In New York State alone, more than 7,500 people are waiting for a kidney. Sometimes the wait can be long. More than 1,300 New Yorkers have been waiting for over 5 years for a transplant. There is good news, though. In 2020, there were 22,817 kidney transplants in the U.S. All of those transplants were made possible through the generosity of living donors, deceased donors, and donor families. 17,583 donated kidneys came from deceased donors. 5,234 came from living donors. Most people are born with 2 kidneys, and they're each about the size of a fist. The main job of the kidneys is to filter wastes and extra water out of your blood. This makes urine. This filtration process helps to keep the levels of electrolyte in your body stable. These electrolytes include sodium, potassium, and phosphate. Every day, the 2 kidneys together filter between 120 and 150 quarts of blood. Your kidneys also help to control your blood pressure and make hormones that your body needs to stay healthy. Each kidney is made up of about 1 million filtering units called nephrons, and each of these nephrons filters a small amount of blood. The small filters in your kidneys can be damaged in many ways. High blood glucose from uncontrolled diabetes and high blood pressure are among the factors that can cause kidney damage. Damaged kidneys can't filter blood as they should, and this causes wastes to build up within the body. The top risk factors for chronic kidney disease are diabetes and high blood pressure. Other risk factors include heart disease, obesity, lupus, a family history of kidney disease, high cholesterol, and also age. The function of your kidneys naturally diminishes somewhat over time. Kidney disease can affect people of any race and ethnicity, but the disease is more prevalent in some communities than others. African Americans, Hispanics and Latinos, and American Indians are more likely to develop kidney disease than whites. Diabetes and high blood pressure are the leading causes of kidney failure among African Americans. Since 2000, the number of Hispanics and Latinos with kidney failure has increased by more than 70%. Diabetes is the leading cause of kidney failure among American Indians. Genetics, social factors, and economic status can all influence the risk of kidney disease and the risk that kidney disease will develop into kidney failure. Kidney damage caused by diabetes usually occurs slowly over many years. The good news is that people with diabetes can take steps to protect their kidneys. These steps may slow the progression of kidney disease and prevent damage. The longer someone has diabetes, the more likely it is that they will develop kidney damage. If you have diabetes, you're more likely to have kidney disease if your blood glucose is too high or your blood pressure is too high. For most people, the blood pressure goal is under 140/90. High blood pressure can damage the blood vessels in the kidneys. When the force of the blood flow is high, blood vessels stretch so that the blood is able to flow more easily. Eventually, this stretching creates scars and weakens the blood vessels throughout the body, including the blood vessels within the kidneys. When the kidneys' blood vessels are damaged, they may stop removing wastes and extra fluid from the body. This creates a dangerous cycle since the extra fluid may then raise blood pressure even more. Diabetes is the leading cause of kidney failure, followed by high blood pressure. Among the other causes of kidney failure are glomerulonephritis, lupus, heavy metal poisoning, immune system disorders such as Goodpasture syndrome, rare genetic conditions such as Alport syndrome, infection, drug interactions, and other causes. What steps can you take to protect your kidneys? For people with diabetes and high blood pressure, or both of those conditions, managing those conditions is very important. Choosing foods that are healthy for your heart and for your entire body is also a good way to protect your kidneys. Some healthy foods include fresh fruits, fresh or frozen vegetables, whole grains, and low-fat or fat-free dairy products. Make sure to eat healthy meals and cut back on salt and added sugars. Try to aim for less than 2,300 milligrams of sodium each day, and try not to have more than 10% of your daily calories come from added sugars. People with a diagnosis of kidney disease and people on dialysis may have special dietary restrictions. One way to keep your diet interesting and healthy is to cook with a mix of spices, not just salt. Other whole body health choices can also protect your kidneys. Try to make physical activity part of your routine. Doctors recommend being active for 30 minutes or more on most days. This can be as simple as taking a walk. Also try to aim for a healthy weight. Make sure to get enough sleep, between 7 and 8 hours each night. If you're overweight, work with a healthcare provider or dietitian to create a realistic weight loss plan. Drinking too much alcohol can increase your blood pressure. Alcohol also adds extra calories, which can lead to weight gain. If you drink alcohol, try to limit yourself to 1 drink per day if you're a woman and 2 drinks per day if you're a man. For reference, 1 drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. Reducing stress is also an important way to protect your kidney health. Smoking is linked with many health issues and may limit oxygen to the kidneys. Smoking increases the risk of kidney disease and its progression. Making sure that you're taking your medicine correctly is especially important for people at higher risk of kidney disease. ACE inhibitors and ARBs are 2 types of blood pressure medicine that can slow the loss of kidney function and delay kidney failure. If you're having a side effect or other problems with your blood pressure medicine, make sure to talk with your medical team about alternatives rather than discontinuing your medicine. High blood pressure can cause damage to your kidneys even if you're feeling well. In 2018, the FDA approved a new drug for people with polycystic kidney disease. This drug can slow the development of cysts on the kidneys and so help to preserve kidney function. When you pick up prescriptions or over-the-counter medicine, make sure to ask your pharmacist how the product might affect your kidneys and how it might react with other medicines that you take. It can be helpful to fill all of your prescriptions at one pharmacy or pharmacy chain so that they can monitor all of your medicines and supplements and check for harmful interactions. Some over-the-counter medicines can pose a threat to your kidneys, so take special care when you're taking them, especially if you're sick or dehydrated. NSAIDs, or non-steroidal anti-inflammatory drugs, are commonly used as pain relievers or fever reducers. Unfortunately, they can also pose a threat to the kidneys, especially if taken inappropriately. Make sure to talk with your physician and your pharmacist about your use of NSAIDs. Make sure to talk to your doctor about your kidney health and any concerns that you may have. If you're at higher risk of kidney disease, make sure that you know your blood pressure, your GFR, or glomerular filtration rate, the amount of albumin, a type of protein in your urine, and also your blood glucose. Most people with kidney disease don't have any symptoms. The only way to know for sure is to get your kidneys checked. Right now, medical associations and the government don't recommend kidney testing for everyone, but they do recommend testing for those at risk. There are both blood and urine tests that will check your kidney function. Your healthcare professional will check your urine for albumin, which is a protein, and will also do a blood test to see how well your kidneys are filtering your blood. If you have diabetes, get checked every year. If you have high blood pressure, heart disease, or a family history of kidney failure, talk with your healthcare provider about how often you should get tested. The sooner that you know you have kidney disease, the sooner you can get treatment to protect your kidney health. A damaged kidney doesn't filter the blood as well as a healthy kidney does, and so more protein may end up in the urine. High levels of protein in the urine can indicate kidney problems. A blood test for kidney function, called the eGFR, is now part of a standard blood test. People with kidney disease may not notice any symptoms, especially in the early stages. Some symptoms of advanced kidney disease include chest pain, dry skin, itching or numbness, feeling tired, headaches, increased or decreased urination, loss of appetite, and muscle cramps. Nausea, shortness of breath, sleep problems, trouble concentrating, vomiting, and weight loss are also symptoms of advanced kidney disease. People with chronic kidney disease may also develop anemia, bone disease, and malnutrition. Chronic kidney disease is a progressive disease, meaning it gets worse over time. Kidney disease can lead to other health problems, such as heart disease, stroke, or heart attack. High blood pressure can be both a cause and a result of kidney disease. High blood pressure damages your kidneys, and damaged kidneys don't work as well to control your blood pressure. If you have chronic kidney disease, you also have a higher chance of having a sudden change in kidney function caused by illness, injury, or medications. This is called acute kidney injury, or AKI. Some loss of kidney function from AKI may not be permanent. Many people are afraid to learn that they have kidney disease because they think that all kidney disease leads to dialysis. However, most people with kidney disease will not need dialysis. The best way to slow or prevent chronic kidney disease is to try and reach your blood glucose and blood pressure goals. Healthy lifestyle habits and taking your medicines as prescribed can help you to achieve these goals and improve your overall health. Dietary modifications may slow the progression of chronic kidney disease. These changes to your diet include decreasing the amount of animal protein that you're taking in, decreasing the amount of phosphorus additives, and limiting the amount of salt that you have. Any of these changes should be done in conversation with a medical professional. Medical nutrition therapy is an individualized plan made for you based on an assessment of your needs by a registered dietitian. The process includes special education on dietary needs and may be effective in helping to slow the progression of kidney disease and may help people to prevent or delay end-stage renal failure. Unfortunately, only 10% of non-dialysis patients see a dietitian. There are two main types of dialysis treatment used for people whose kidneys have failed. Hemodialysis is a treatment that removes wastes and extra fluid from your blood. It can be done at home or in a dialysis center. During hemodialysis, the blood is pumped through soft tubes to a dialysis machine where it goes through a special filter called a dialyzer, or an artificial kidney. As the blood is filtered, it's returned to the bloodstream. Only a small amount of blood is out of the patient's body at any time. In-center treatment usually takes place for 3 to 5 hours, 3 times a week. People who do home dialysis have more flexibility about how often it can be done. If it's done daily, the treatment time would be about 1.5 to 2 hours. Peritoneal dialysis is a home-based treatment that can be done anywhere. It must be done daily. a patient needs a minor operation to place a catheter inside the abdomen before beginning peritoneal dialysis. The blood is cleaned inside of the body, not outside. The lining of your abdomen, known as the peritoneum, acts as a natural filter. During this treatment, a cleansing solution flows into the abdomen through a soft tube. Wastes and extra fluid pass from the blood into the solution. After several hours, the solution is then drained and refilled with a fresh cleaning solution to begin the process again. It usually takes about half an hour and is called an exchange. Kidney transplantation is also an option for some patients whose kidneys have failed or are about to fail. In a transplant, a healthy kidney from a donor is transplanted into the body of the patient. The kidney may come from a deceased donor or from a living donor. Once someone receives a kidney transplant, they'll need special medication to keep their body from rejecting that transplant. Usually what happens is that the transplanted kidney starts acting as a filter, the way that a person's original kidneys did. Kidney transplantation is a treatment, but it's not a cure. Kidney transplant recipients still have a chronic disease and may still need additional medications. Erie County Medical Center is the transplant center that serves our region. The Kidney Foundation works closely with ECMC to provide kidney health and transplant information to the community. ECMC has a shorter wait time for kidney transplant than any other center in the country. In 2020, ECMC performed 134 kidney and kidney pancreas transplants. Local people who need a kidney transplant may also be working with other centers. Common ones that we see are University of Rochester Medical Center, Strong Memorial, the University of Pittsburgh Medical Centers in Erie or Pittsburgh, and Cleveland Clinic. I'd like to talk a little bit about our organization, the Kidney Foundation of Western New York. We're based in Buffalo and are dedicated to increasing awareness and improving the lives of those with kidney disease. We provide patient support, advocacy, and assistance with emergency needs. We're not affiliated with the National Kidney Foundation, but we do work closely with local health organizations in our community. Within our 8-county area, the Kidney Foundation of Western New York works to raise awareness of kidney disease. We also try to increase public knowledge of the risk factors that can lead to kidney damage. We provide information on the prevention and treatment of kidney disease to patients and families. Our organization also provides professional education for people in dialysis, physicians, nurses, and others who work with kidney patients. We work to promote organ donation, both among living donors and among deceased donors through the New York State Donate Life Registry. In most years, our foundation provides free community health screenings with community partners. Right now, those screenings are on hold during the COVID-19 pandemic. Within the 8 counties of Western New York, we provide patient support and advocacy, we offer information on healthcare options, and we assist with emergency needs. These needs can include information and emergency assistance such as nutritional supplements, medical ID bracelets, transportation to and from dialysis and other medical appointments, and financial assistance for people with kidney disease who are facing an emergency. You can reach the Kidney Foundation of Western New York by leaving a voicemail at 716-529-4390. We also have information, resources, and more on our website at kfwny.org. We use Facebook and other social media platforms to share information about kidney health and our programs. Here are some additional resources for people with kidney disease and their loved ones. The Kidney Connection is a website on which people can share their story in hopes of finding a living kidney donor. The Living Kidney Donors Network shares information and resources to help people find living donors. We've worked with them to provide a series of online videos entitled Having Your Donor Find You. It's available for free for local kidney patients through the Kidney Foundation of Western New York website. The Western New York Kidney and Transplant Support Group meets each month. During the COVID-19 pandemic, their meetings are online. A Healthy Living Pantry has special dietary options available for people with kidney disease who have limited resources. Local and national dialysis chains provide information on dialysis treatments, as well as dietary changes necessary for people with kidney disease. ECMC and other transplant centers also have important information available for people with kidney disease and those seeking a transplant. The kidney health information included in this presentation came from a number of sources, including the Centers for Disease Control, the Health Resources and Services Administration, and the National Institutes of Health. Images also come from the National Institutes of Health, the Centers for Disease Control, and the Kidney Foundation of Western New York's own collection. Information on kidney disease and COVID-19 comes from the American Journal of Kidney Diseases and the Cleveland Clinic Journal of Medicine.